Awesome. All right, so thank you all again so much for joining us today for News from the Frontlines NCHAV and Health Policy Update webinar with the North Carolina AIDS Action Network. For folks who do not know me, my name is Matt Martin, and I serve as the Grassroots Advocacy Manager here at the North Carolina AIDS Action Network. We were talking over the past couple weeks, and with everything that is happening at the NCGA and around HIV and health policy going on in North Carolina, it can be a lot to process and a lot of kind of unanswered questions. So we wanted to provide a quick policy update webinar for folks throughout the state, just to make sure we're all in the know and aware of what's going on at the NCGA and beyond, and how we can take some action steps to make sure that we are being the best advocates we can be for our HIV and healthcare communities here in North Carolina. We're really excited to be joined with some folks from some coalition partners today, and I will go ahead and pass it off to our first presenter, who is Hyun Namkoong with the NC Justice Center. So Hyun, the floor is yours.
Thank you, Matt. Hello, everyone, and thank you for hopping on today's webinar. I'll just be giving y'all a quick update on sort of what's going on inside of the legislature and where things are with Medicaid expansion. So Matt, yeah. All right, so right now we are in budget season, and we have no idea how long it could go on. Where we are right now with the budget is that both chambers have selected conferees to come together and vote on a conference report that will have a budget compromise that they will be submitting to the governor. So, each of the House and the Senate passed their own budget version, and now they're coming together to create something to send on over to the governor. And it'll be up to the governor to decide what action he wants to take when he receives that budget. One of the actions that we are suspecting that he will take if the budget does not include Medicaid expansion, which we are expecting that it won't have, is we believe that the governor will be vetoing whatever budget comes his way. He has said time and time again, and Matt, you can go to the next slide if you like, that he will veto any budget that doesn't have Medicaid expansion in it. His messaging is probably going to be along not only that the budget that he received didn't include Medicaid expansion, but that it didn't have enough teacher pay increases. At that point, what happens is once he vetoes a budget, it'll go back over to the House. And we can go to the next slide, Matt. And the House will have to decide whether or not they want to overrule the governor's veto or if they want to sustain the governor's veto. If the Democrats want to sustain the veto, then they need to stay aligned with the governor, particularly in the House. We need for Democrats to vote to sustain his veto. We need them to be on board with messaging in terms that the budget needs to include Medicaid expansion. It needs to have high teacher pay raises. And this whole time leading up to this moment, we have always believed that Medicaid expansion would come down to budget negotiations, simply because the budget and voting for the budget provides very conservative Republicans enough political cover to be able to say that, well, this is something that I had to vote for. The state needed a budget. I couldn't not vote for the budget. So at this point in time, what we are focusing on is making sure that Democrats in the House will be voting to sustain the governor's veto and will be aligned with him. And we have a few concerns about whether or not that will happen, simply because a few weeks ago, the Senate was voting on their budget, and we saw 3 Democrats vote for the Senate budget, which we were surprised to see. The threat here with House Democrats stepping out of line and overruling a governor's veto is that House Democrats are being offered what we call pork for their home districts. So what we want to do as advocates is really drive home the message that Medicaid expansion brings X amount of dollars to your district. It covers X number of people. It saves your county hospital this amount of money from not having uncompensated care. It brings this number of jobs. As we all know, health is just so intersectional. And so, even if these certain Democrats are being offered maybe one or two budget line items, it really doesn't compare to what the overall impact and effect of Medicaid expansion could do for their district. So those are just some of the things that we're trying to drive home. And then also just remind them how important Medicaid expansion is and remind them of their commitment to this issue. So some of the actions that we could have folks on this webinar do is, as we're in this process, is if folks could start writing letters to the editor on why a North Carolina budget needs to include Medicaid expansion, needs to have high teacher pay raises, that healthcare can't wait. When we wait on healthcare, that's when people accrue medical debt, they go into bankruptcy, they experience horrible health outcomes, and in the worst cases, even death. We will need folks to call their legislators to support the governor's veto, in particular House Democrats, and just to stay engaged with NCAN for upcoming actions. I'm sure NCAN is going to be sending out action alerts as we continue through this process. All of the rumors say that it's going to be a long road ahead. Even if the governor's veto is sustained, as we are hoping and expecting that it will be, the question from there is, then what? So negotiations could be long, and so that's why it's really important for folks like y'all to stay updated with what's going on and to be able to plug in and jump in as things progress. Thank you.
Awesome. Thank you so much, Hyun. And for folks who are on the line who might have questions, if you don't mind holding your questions until then, there is a chat function in case you do have some immediate questions that you want to ask. But we will have a brief period at the end for Q&A for our panelists, so that we'll hopefully be able to answer any questions you have. But do feel free to use the chat function in the meantime. So thank you so much, Hyun, for joining us. And next, we are going to turn it over to Lynette Tolson, who is the Executive Director of the North Carolina Public Health Association, to talk about communicable disease funding at the local level through the budget. So Lynette, the floor is yours.
Okay, thank you. I hope you all can hear me okay today. Thanks for giving me the opportunity to talk about this, Matt and Lee. I do appreciate it. Matt, if you want to go ahead and move on, let's talk about communicable disease in North Carolina. I actually am the executive director for the NC Public Health Association and the NC Association of Local Health Directors. So I focus a lot on public health at the local level with a real focus on public health in a local health department. So in North Carolina and nationally, communicable disease is a well-recognized core public health function. That is a major role for local health departments. And we equate it to a public safety mission of law enforcement and emergency management. We like to say that local public health is your first line of defense against diseases. Okay, Matt, keep going. So what's going on with communicable disease programs at the local level? And this is not just in North Carolina, this is a common theme across the country, is that we're finding a diminished infrastructure funding. There's no funding there for local public health's ability to do the mandated services to protect the public's health from communicable disease, or any new and emerging diseases for that matter. As you know, we've had Zika and all sorts of things come out over the past few years. So all these new emerging diseases are putting a real stress on a system that's already at capacity. And for example, in 2017, our local health department communicable disease nurses, so they are the key to the program, or our communicable disease nurses. And they responded to over 300 outbreaks across our state. Well, that doesn't sound like a lot, but it is, because in addition to the 300 that were actually outbreaks, right now we're looking at preliminary data from January through December of 2017 that shows that in addition to the true outbreak investigations, over 31,000 investigations of diseases were conducted statewide by these nurses. almost 6,000 of, in addition, there was almost 6,000 investigations of foodborne disease. So when you're all listening to the news and there's an outbreak from someone eating something at a restaurant, it's the health department, the communicable disease nurses out there doing the investigation, trying to figure out, we call them the CSI of public health, right? They're out there trying to figure out what was the problem, what was the culprit, and then who was exposed to it. And so these cross county lines, they cross state lines in many instances, takes a lot of time and investigations to do the food. Also, 87,000 investigations on gonorrhea and chlamydia. And these nurses are out there doing all these investigations, making sure that no one else is out there transmitting these diseases. What does that mean? That means that, especially in the rural communities, keep going, Matt, in the rural communities, what you find is that a communicable disease nurse may be the only nurse in that rural health department. So if they have clinical services, if there's an outbreak, the clinical services will halt so that that communicable disease nurse can then go and investigate and figure out what's been going on with this outbreak. So the clinic shuts down, puts everything on hold so that then they can begin to do communicable disease investigations. Another example of what's going on is in our state, we're experiencing a dramatic increase in reported acute hepatitis C infections. And we all know that that actually has a true connection with the current epidemic of opioid abuse. In fact, in 7 years, we saw our numbers triple with the increase of reported Hep C cases. So local health department staff, they assist in the follow-up of the acute Hep C cases. Once again, once that staff person has been taken away from its clinical program and is out there looking at Hep C cases, just like with all the other communicable diseases, they're being taken away from other clinical primary care prevention type programs. We also, we can talk about the emerging diseases like Ebola and Zika and the vaccine preventable infections that are going on. You're reading about it in the news, whooping cough, mumps, measles, etc. These are all happening today at phenomenal numbers across our state. And we are seeing, on the flip side, we're seeing the funding for local health departments for communicable disease programs decrease. So what does that mean? That means that the health department is not there to do all the other programs that it needs. Education on communicable disease. The state mandates that the health department goes out and educates the community on communicable disease, the spread of communicable disease. The health department is mandated to work with private physicians on what to do if someone comes into their clinic and they're tested for communicable disease. So that physician is supposed to contact the health department, and there's a process for all that. This is not being done today in our state because of lack of funding. So next slide. So what's going on? So the health departments, the NC Public Health Association and the Local Health Directors Association have been working, this is our third year now, trying to get some funding for local health departments for the communicable disease program. The program includes the nurses, which are imperative, we've got to have those. They're the ones that do all the investigations and the treatment, but it also includes the education and all the experience needed for communicable disease outbreaks. So it's a huge program that they're mandated to do at the local level. There's no funding. Some counties may get $9,000 from the state. Some may get as much as $20,000 from the state. But just looking at the few numbers I showed you earlier, that little bit of funding does not go very far when you're having to investigate 37,000 potential outbreaks. So we have worked with the House and Representative White from Johnston County. The House, Representative White and the House leadership actually introduced a bill for $8 million recurring funding that would go to health departments for the program, the communicable disease program. However, when it came out in the budget, House Bill 966, the budget bill that we just heard a little bit about, there was $4 million recurring for communicable disease program at the local level. And these funds would be allocated. Each health department for each county that it serves would receive $20,000. And what that means is some counties have standalone health departments, but there are some counties that came together and formed a regional health department, which may be 2 or more counties under the auspice of one health department. So for each county, they would get $20,000. The remaining $2 million, DPH would distribute to the health departments based upon population, so that the larger communities such as Wake County, Mecklenburg County would get more of that remainder $2 million. These funds would allow health departments to have a minimal, this is not the answer, this is a step in the right direction, but this is not a final answer, but it would begin to give the health departments a little bit of breathing room to have a minimum set of resources available to perform their local communicable disease control and prevention. That includes, again, the outbreak response, the community and public health surveillance, the educational outreach activities, and to appropriately and timely address and manage these disease threats in order to prevent and decrease morbidity or mortality. So it's so important for these health departments to be able to have these funds to do the program that they're mandated to do by the state. So the House recognized it. They said, okay, we're going to give you $4 million recurring. So let's see what the Senate did. Matt, you want to keep going? Oh, back. There you go. The Senate said, oh, you know what? That might be a nice program, but guess what? We're not including it. They took all the funding out for the local communicable disease program. So there's no money on the Senate side for the local communicable disease program. So what does that mean? As you just heard, there is a conference committee that is meeting and going to decide what's in the budget. I understand yesterday they were to get their target numbers, which means they know how much money they can spend in the Department of Health and Human Services. So our hope is that the Senate said, okay, we're going to give you more money to spend in HHS Senate leaders, and that they will include the $4 million for the local communicable disease program. So Matt, if you want to move on. So what can you do to help? So the NC Public Health Association is asking for your support by calling your legislators, especially focused on the Senate, and ask that they support the House version of the budget that includes the $4 million appropriation for the local communicable disease program. We are working this through our NC Public Health Association. We currently have over 1,200 members. Certainly our local health directors are working on it. We would love to have you guys join on board. Send an email, make a phone call, especially with a focus on your Senate, and ask them to support the $4 million appropriation for the communicable disease program in the local health department. And I know that was very brief, and we can talk a lot about what goes on in communicable disease programs, but I hope that gives you guys a good idea of a little bit about what they're doing and why this funding is so important to the local communities.
Awesome. Thank you so much, Lynette, for that. Super informative. And we will, so I've got the Q&A slide pulled up, but first I'm going to turn it over to Lee to give a couple of more updates around some specific HIV and health policy stuff that we've been focused on. So Lee, the floor is yours.
Awesome. Matt, is my volume okay? Can y'all hear me clearly?
Yep, you are perfect.
Awesome. Well, thanks everybody for joining this call. And I just want to give a special shout out to Hyun and Lynette. We've started making a regular practice of doing these webinars just because we think they provide a really valuable opportunity for us to share directly with our membership, with those of y'all on the front line doing this work, kind of what's happening regarding health policy and HIV and hepatitis at the General Assembly. And also a thank you to Judy Montenegro and the team at the Latino Commission on AIDS, who've been very kind to help us step up our technology game with this webinar usage. Just a couple of highlights I'll note to further elaborate on what Hyun and Lynette have talked about. I know many of y'all on the call participated in HIV Speaks on Jones Street, our statewide advocacy day a couple months ago. had a really fabulous turnout and are so thankful for folks who participating. Myself and John Thompson, our lobbyists, have been able to have several really powerful conversations with some of the legislators and staff members who folks identified over the course of that day as having good constituent conversations with. And that event just continues to build momentum and grow. Obviously, the two things we talked about that day were around Medicaid expansion and closing the coverage gap, which Hyun did a really nice job of, telling us that this issue isn't dead for this cycle and we've still got work to do. Just as a reminder, we particularly think Medicaid expansion is so critical for folks working in HIV because it's going to provide an opportunity for more people who are currently enrolled in the HIV medication assistance program who fall in that income gap where they can only receive free medication. That if we expanded Medicaid and closed the coverage gap, many of those individuals, if not all, would be able to access full health insurance. And we know that when folks get access to full health insurance, they achieve better viral suppression rates and also better health outcomes in regards to all of the health issues that we all have, regardless of our HIV status. The other issue we talked about at HIV Speaks on Jones Street was directly funding for the communicable disease program within the Division of Public Health of a recommendation of around $900,000 to both address hepatitis C and hopefully be able to address some work around PrEP and other HIV. That budget appropriation did not move forward in either the House or the Senate budget. So for all practical terms, at least for this year, that appropriation request is dead. We believe, though, and I think really strongly, that a lot of the goals we had through that funding recommendation can be achieved with the recommendation that the local health directors and the Public Health Association have been talking about, which Lynette presented on. So I think we're going to continue this year and years forward thinking about how we can be strategic and thoughtful about identifying how to fund broader communicable disease. And also know that all of these other things Lynette talked about, thinking about how we have good infrastructure for treating gonorrhea, how we treat chlamydia, other sexual transmitted infections, building strong infrastructure for all STIs really ensures that our response to HIV can be thoughtful across the state. So I wanted to give just a couple highlights of things the North Carolina AIDS Action Network has in the coming months and over the course of the next year. As folks know, we have hired a new team member, Dante Pryor, who many of y'all have probably had the chance to meet over the course of this year to help increase our capacity to do Medicaid expansion work. He and Christina and Hyun are going to be headed out to Elizabeth City in the eastern part of North Carolina next week on June 18th for a Medicaid expansion event in Elizabeth City that's occurring on the campus at Elizabeth City State University. So for any of our folks out east, or if you are not out east and want to take a long drive, would love to see you next Tuesday on June 18th. On July 13th, we have a training in Wilmington, North Carolina, focused on the value of the existing Medicaid program. We've been lucky to have a major investment and new partnership with Community Catalyst, a nonprofit based in Boston, particularly to build support, not just for Medicaid expansion, but really more specifically for the existing Medicaid program, which is the largest payer and supporter of people living with HIV in terms of insurance in the state. So we're hosting a training to really build our infrastructure as a network and for people's ability to be a true ambassador for Medicaid in Wilmington on July 13th from 10 a.m. until 3 p.m. And then, as many of you know, we do always hold our annual conference. This year, we are going to be in the Queen City and Charlotte, North Carolina on November 15th and 16th. And ask that folks really hold that date, and registration is going to open in July. It's always a really powerful moment for our whole network to come together and really spend some time to recognize some of our movement leaders through our annual Advocate of the Year awards, and also train and think about how we can all be better advocates for the work we care about and support each other. And finally, I think many of you know that we have embarked on a major initiative with the Division of Public Health and the Department of Health and Human Services over the course of this year to work on North Carolina's Ending the Epidemic Plan. We are about to announce, and some of you may have seen some of this already, 9 major listening sessions around the state, from Bryson City out west down to Wilmington, Elizabeth City in the east, to really take an opportunity to get together in person with folks across the state to talk about our strategies to really reduce the number of new transmissions, best support people living with HIV, and end the epidemic. The first listening session is going to be in Durham. That is later this month on June 24th. and we'll be announcing the rest of the locations over the course of the coming weeks and months in partnership with our folks at DHHS. So the legislative session is winding down. Well, let me pause. We think the legislative session will wind down, although as Hyun reminded us, there is much to be decided, and sometimes these sessions get dragged on for a long time, but certainly a lot of opportunities over the next year to engage in the work of HIV treatment and prevention advocacy. With that, I will close out and pass it back to you, Matt, and open it up for Q&A. My email address and Matt's are both on the slide on the webinar, so can certainly take questions over email offline, but we'll pass it up to Matt to open up for Q&A now.
Awesome. Thank you all so much for that. And we will go ahead and jump right into Q&A. So if you have any questions, there should be a Q&A option as well as through the chat function. Feel free to use either of those, and we will do our best to make sure that we can get those questions answered for you. And we'll leave that open for a couple minutes. Also, if you have any questions that you do not wish to ask over the webinar, both mine and Lee's contacts are on the current slide. It's on the screen right now. Feel free to reach out to us, either matt@ncaan.org or lee@ncaan.org. And we'll be happy to answer those questions or be able to find the answers for you. So Judy, I will say I have got a red dot for Q&A that it is not letting me click on. So I'm not sure what the question will be.
I'm happy to read that. A quick number check from your slide on number of investigations would indicate that roughly 1% of our population is subject to investigation. If I get diagnosed by my GP with Hep C or chlamydia, I doubt it would kick off an investigation. So my question is, what is the definition of investigation and what would kick one off?
So Lynette, I think that might be a question for you.
Yeah, I'm trying to unmute. I'm sorry. Yeah. So an investigation would be if you had a communicable disease, the investigation would be around how many people had you exposed to that communicable disease. Are there any exposures? Are there people living in the home with you? Have you been to church? Have you been to the grocery store? Depending upon what the communicable disease is it airborne or is it sexually transmitted? Or so depending upon what the disease is, depends upon how you would transmit it. So that would be what the investigation would be around. I hope that helps.
And I think, this is Lee, one thing just listening to that question, sort of further elaborate. Lynette, that's in reference to all communicable disease sort of investigations happening on the local level, correct? So not
Correct.
just like HIV, chlamydia, gonorrhea, and STI, but all
diseases. Absolutely.
It's a much broader context that we're often working in for folks who are really focused on HIV advocacy.
Exactly.
Awesome. Thank you for that, Lynette. Question for Hyun. If Medicaid expansion does not happen this year, would it be able to be considered next year?
Wow, that's, I hope that's not what we are looking at. Honestly, you know, the General Assembly has not been in this kind of political environment before, at least not for the last 8 years. So this is something that's very new for Democrats. It's something very new for the GOP, that there actually has to be some level of compromise for you know, folks on both sides of the aisle to come together and do something about it. Through talking with folks, you know, some people are saying that these budget negotiations could last as long as December 2020. I really hope that those are exaggerations. You know, some people are saying that they might last, you know, past the Republican primaries next year. So yes, if it does not happen this year, there is certainly a possibility for happen next year, especially if it's due to it being related to the budget and negotiating around that. One thing I didn't mention is that if for some reason the governor's veto is sustained, then it just means that North Carolina will have to use the budget from the last 2 years, and that anything that's a non-recurring item does not get included again. So, a lot of folks would be affected by this. It's not exactly a government shutdown, but, for some people it could be to that extent. So we know that neither party wants that to happen. So our hope is that it'll happen as soon as possible, but absolutely it's a possibility that it could happen next year.
Awesome. Thanks, Hyun. Another question that we've got, I think this is for you, Lynette. They said, thank you for your answer on what an investigation is. Second part of the question is, what kicks off an investigation and how do you choose what to investigate?
So there certainly are, how do you choose? So somebody comes in and they test positive for communicable disease. Certainly there is a list of communicable diseases that the state asks that we, follow. And at that point, there is a procedure that the communicable disease program at the state asks that works with the locals to help us follow. In fact, sometimes the state may even come in and help the locals do the investigation. So there has to be a test, there has to be a positive result that says, yes, this is a communicable disease. And then they follow the process. It's all science, evidence-based. They work with CDC, they work with the feds. Everything is done Everything is done in line with the science and evidence-based procedure manual that public health has to follow. Kind of stumbled around my words, but I hope that helped.
Awesome, thank you. And then next, so I know we Wanda asked a question to all the panelists, and this might be something that we can work on to disseminate to folks. She said, appreciate having the breakdown of those legislators insisting on pork funds to be included for them to support the budget, and would also like to know of the senators and other legislators who don't support communicable disease funding, if they have any investigations currently happening in their district. So that is something that we can certainly try to work on and get out to folks, because I think that would be valuable information to know. We also have another Q&A question. This is specifically around conference. If there is going to be a theme for conference this year, because with a couple years ago we had the Trans Health Summit in Charlotte. I will say that is currently in the works, and as we continue to move forward with that, we will be able to answer those questions a little bit better.
Actually, Matt, so to the question about conference, we can go ahead and share that I think this is like the first moment that we've officially shared this, but we do have a special guest coming down to be one of our major keynote speakers. Rita Harcrow is a federal employee of the Housing and Urban Development Program and is their director of the Office of HIV and AIDS Housing. She specifically manages the HOPWA program, or Housing Opportunities for Persons with AIDS program, which, if folks don't know, is the only federal housing program that's specific to a disease or a specific medical condition. So she's been a long time HIV movement leader, worked in the community before becoming a federal employee, and in the auspice of her office is managing the modernization of the HOPWA program, which was approved by Congress in 2016 and is leading to a significant increase of money coming to North Carolina over the next 5 years, specifically dedicated to housing for low-income folks. So we're really excited for her to be coming down here. North Carolina is actually one of the major winners of that modernization formula in terms of how modernization is occurring and more money coming into states because of our housing burden. So that's just an exciting moment, I think. And we've been thinking about how, with her presence, really thinking about how we focus on social determinants of health and think about issues around food instability, around housing, around transportation, and our HIV response, maybe isn't a theme, but kind of a part of the conversation. real quick, and if Hyun and Lynette want to add to this, you know, I'd prefer not to, in terms of Wanda's question about, you know, specific legislators, particularly in this setting on a recorded webinar, I'd prefer not to sort of name any names of specific policymakers. What I can say is that I think it is always helpful to email your state House member and your state senator as your first point of action and telling them you want them to stay strong, to support Medicaid expansion, and if the governor vetoes the budget because it does not include Medicaid expansion, to support that veto. I would say it probably is helpful, though, for every Democratic member of the House caucus to hear that, because it is critical that the vast majority of House Democrats support that veto if we want to have sort of a major compromise around Medicaid expansion this year.
Awesome. Thank you, Lee. So we are getting close to the quarter till mark. If I will give just another couple minutes in case any other folks have any other questions. So I have not seen any more come in the past couple of minutes. So I think we will probably go ahead and start wrapping up. Again, a huge thank you to everybody who was able to join us today for all of your thoughtful questions and engagement in this. A huge thank you to our panelists, to Hyun, Lynette, and Lee for presenting today. And a big shout out to Judy and her team at the Latino Commission on AIDS. Thank you all so much for your continued support of this and for helping us with these webinars. If there are no more questions, I think we are good to go ahead and stop the recording, and we will be sending this out over our listserv and via our website and whatnot. So be sure to keep a lookout for that so you can share with other folks. And other than that, hope y'all have a great day, and thank you again for joining us.